The Crisis Response Plan, or CRP, has only been tested for efficacy in adult samples, but the procedure can be adapted for use with younger populations as well. Several adaptations of the CRP for use with suicidal youths are discussed in this brief video. Before discussing these, let's quickly review the components of the CRP. A more thorough discussion of the CRP can be found in the video entitled, "What is the Crisis Response Plan?" The CRP is comprised of 5 key sections and is typically handwritten on an index card or another conveniently sized piece of paper. Personal warning signs are internal indicators of an emerging emotional crisis and help the individual to know when they are heading towards a crisis. Self-management strategies are simple strategies that can be used to help reduce stress or serve as a distraction during times of intense distress. Reasons for living are things that provide a sense of purpose or meaning in life. Social support includes people who provide support or elevate one's mood during tough times, such as friends and family members. Professional crisis support services include contact information for healthcare providers, crisis hotlines, and emergency services. When working with suicidal or at-risk youths, these 5 sections can be preserved, but it's important to keep in mind the developmental level of each youth and to adapt your language and approach. For adolescents and teenagers, the CRP can usually be preserved without much need for adaptation or modification, although many teenagers and young adults find the CRP more appealing if it can be tied to their smartphones. This can be done a number of ways, the most basic of which is to take a picture of the handwritten CRP for storage on their phone. Another option is to complement the handwritten CRP with an app. A number of apps have been developed for the purposes of suicide prevention, but the app we have used the most is a virtual hope box, which is available for download on both the iPhone and Android platforms. The virtual hope box includes games, inspirational quotes, and relaxation and meditation recordings that can be used as self-management strategies. The app also allows users to select songs to listen to, pictures to view, and phone numbers of contacts to call, all of which are already saved on the phone. These options align with the reasons for living and social support sections of the CRP. The Virtual Hope box also includes the contact information for the National Suicide Lifeline. Finally, the app also includes several other features that are based on empirically supported treatments for suicide prevention. For preteens and younger, the CRP can be modified in other ways to be more age-appropriate. For example, pediatric and child clinicians have found it helpful to use pictures, images, and drawings instead of writing. Some have also found it helpful to create a storybook, with each page of the book dedicated to a different section of the CRP. The child and clinician can create this book together as an art project focused on the story of how the child manages difficult or challenging situations. The story can also be updated as a child learns more strategies to use and learns more about their ability to effectively cope with stress. A final consideration when working with youths is to be mindful of who they list as sources of social support. Sometimes the friends and peers to whom youths reach out during times of stress can be less helpful than the youth realizes. Some peers, for instance, may actually reinforce poor coping because they lack effective self-management strategies of their own. Encouraging youths to identify and include a trusted adult can also be an important part of their CRP. In summary, the Crisis Response Plan can be adapted for use with children